Metabolic syndrome is an endocrine disease because this picture shows that multiple syndromes, diabetes, hypertension, cardiovascular disease, obesity. This picture shows that organs of body are affected: heart, liver, reproductive system, pancreas, etc. Detail going on. Introduction. Metabolic syndrome is a cluster of conditions that increase the risk of heart diseases, stroke, and type 2 diabetes. The conditions include increased blood pressure, high blood sugar, excess body fat around the waist and abdominal. Cholesterol or triglyceride levels. These conditions occur together, increasing the risk of cardiovascular diseases and other health issues. Metabolic syndrome is also referred to as Syndrome X, insulin resistant syndrome, or dysmetabolic syndrome. A definition. Metabolic syndrome is a cluster of conditions including central obesity, insulin resistance, high blood pressure, high triglyceride, and low HDL cholesterol that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. It is typically diagnosed when a person has at least 3 of these risk factors. Managing metabolic syndrome involves lifestyle changes and in some cases medication to reduce the risk of serious health complications. Types. Metabolic syndrome does not have distinct types, but it is varies based on which combination of the 5 risk factors is present in an individual. 1. Abdominal obesity, waist circumference more than 40 inches in men, 35 inches in women. 2. Elevated triglyceride more than 150 mg per dl. 3. Low HDL cholesterol less than 40 mg per dl. In men, less than 50 mg per del in women. 4. High blood pressure more than 130 per 85 mmHg. 5. Elevated fasting glucose more than 100 mg per dl. The syndrome's manifestation can range from predominantly cardiovascular issues to more pronounced insulin resistance and diabetes related to symptoms. Causes. The exact cause of metabolic syndrome is complex and involves combination of genetic, environmental, lifestyle factors. Key contributors include: 1. Insulin resistance, a condition where the body cells become less responsive to insulin, leading to high blood sugar levels. 2. Obesity, particularly central obesity, where excess fat is stored around the abdomen. 3. Physical inactivity, lack of exercise contributes to weight gain and insulin resistance. Or genetics, a family history of type 2 diabetes or cardiovascular disease can increase the risk. 5. Unhealthy diet, a diet high in fats, sugars and processed foods contributes to obesity and insulin resistance. Risk factors. Several risk factors includes the likelihood of developing metabolic syndrome. 1. Age. The risk increase with age. 2. Race. Some racial and ethnic groups such as Hispanics and Asians have a higher risk. 3. Obesity, particularly central obesity, where fat accumulates around the waist. 4. Family history. A family history of diabetes or cardiovascular disease increase the risk. 5. Sedentary lifestyle. Lack of physical activity contributes to weight gain and metabolic disturbances. 6. Poor diet. High intake of sugar foods, processed foods and unhealthy fats. 7. Smoking. Smoking can contribute to insulin resistance and exacerbates other risk factors. Complications. Metabolic syndrome significantly increases the risk of developing several serious health conditions including: 1. Cardiovascular disease, increase the risk of heart attack, stroke, atherosclerosis. 2. Type 2 diabetes, insulin resistance can lead to the development of type 2 diabetes. 3. Fatty liver disease, non-alcoholic fatty liver disease is more common in individuals with 4. Kidney diseases. This syndrome increases the risk of chronic kidney disease. 5. Polycystic ovary syndrome, a hormonal disorder common in women with metabolic syndrome. 6. Sleep apnea. Obstructive sleep apnea is often seen in those with central obesity. Pathophysiology. Metabolic syndrome is primarily driven by insulin resistance, where the body cells become less responsive to insulin. This resistance leads to hyperglycemia and hyperinsulinemia. The excess insulin leads to increased fat storage, particularly in the abdomen, and further exacerbates insulin resistance. The pathophysiological mechanism also involved: 1. Dyslipidemia, elevated level of triglycerides and low HDL cholesterol contribute to atherosclerosis. 2. Hypertension, insulin resistance causes endothelial dysfunction and increased arterial stiffness, leading to high blood pressure. 3. Pro-inflammatory state, chronic low-grade inflammation is associated with metabolic syndrome, contributing to insulin resistance and vascular damage. 4. Prothrombotic state, elevated levels of clotting factors increase the risk of cardiovascular events. Signs and symptoms. Metabolic syndrome itself often has no symptoms. However, signs may include: 1. Increased circumference, visible abdominal obesity. 2. Elevated blood pressure, often detected during routine checkup. 3. High blood sugar may lead to symptoms of diabetes such as excessive thirst, frequent urination, and fatigue. 4. Elevated triglycerides and low HDL. These are typically identified through blood tests. Diagnosis. Diagnosis of metabolic syndrome is based on the presence of least 3 of the 5 key criteria. 1. Abdominal obesity. 2. Elevated triglycerides. 3. Low HDL cholesterol. 4. High blood pressure. 5. Elevated fasting glucose. 6. Laboratory tests such as blood glucose levels, lipid profiles, and blood pressure measurements are essential for diagnosis. Nursing diagnosis. Nursing diagnosis related to metabolic syndrome may include: 1. Imbalanced nutrition, more than body requirements related to excessive caloric intake. 2. Risk for unstable blood glucose level related to insulin resistance. 3. Risk for impaired cardiovascular functions related to hypertension and dyslipidemia. 4. Risk for impaired skin integrity related to obesity and immobility. 5. Deficient knowledge related to lifestyle modification for managing metabolic syndrome. Management. Disease management. Management of metabolic syndrome involves combination of lifestyle modifications and pharmacological interventions. A lifestyle modification including: 1. Diet. A heart healthy diet rich in fruits, vegetables, whole grains, and lean proteins, limiting sugar, salt, and unhealthy fats. To physical activity, regular exercise such as 30 minutes of moderate intensity activity most days of the week. 3. Weight loss, achieving and maintaining a healthy weight. 4. Smoking cessation, essential to reduce cardiovascular risk. 5. Stress management, techniques such as meditation, yoga, counseling. Treatment. Pharmacological treatment. 1. Antihypertensive agents to manage high blood pressure. 2. Lipid lowering agents strained to reduce cholesterol levels. 3. Anti-diabetic medications, metformin and other drugs to improve insulin sensitivity. 4. Aspirin. In some cases, low-dose aspirin may be prescribed to reduce cardiovascular risk. Psychosocial medicine managing metabolic syndrome also involves addressing the psychological and social aspect of condition. 1. Behavioral counseling to promote lifestyle changes and adherence to treatment. 2. Support groups engaging with others who have similar conditions can provide emotional support. 3. Addressing mental health in screening for depression, anxiety and stress, which are common in individuals with chronic conditions. Prevention. Prevention of metabolic syndrome focuses on adopting, maintaining a healthy lifestyle. 1. Healthy eating, a balanced diet low in refined sugars and unhealthy fat. 2. Regular physical activity, engaging in regular exercise. 3. Maintaining a healthy weight, preventing obesity through diet and exercise. 4. Regular health checkups, monitoring blood pressure, cholesterol levels and blood sugar. In conclusion, metabolic syndrome is a significant public health challenge due to its associated with increased risk for cardiovascular disease, diabetes and other serious conditions. Early identification and interventions are crucial in managing the syndrome and preventing complications. A combination of lifestyle changes, pharmacological treatment and psychosocial support is essential for managing metabolic syndrome effectively. Thank you. Have a nice day.